I thank the leadership, staff, and residents here at the Roosevelt Care Center for allowing us to witness the first vaccinations of our state's long-term care residents and staff. So Sam, to you, to Benzie, where's Benzie, and the whole team here, thank you very much for having us. I also have to acknowledge Mildred Clements, the first resident vaccinated. Mildred recently turned 103. She survived infancy through the flu pandemic a century ago, and today she represents the resiliency and fighting spirit of New Jersey. I have to say that Esther was the first member of staff vaccinated. There were 3 that I witnessed. Mildred was the first resident vaccinated. We witnessed 3 residents. They are the first staff member and resident in the entire state of New Jersey in a long-term care facility to be vaccinated. So not just here at Roosevelt. So bless you. I'm honored as well to be joined by soon-to-be County Commission Director and dear friend Ronnie Rios, also Senator, another dear friend, Senator Sam Thompson. Bless you. I want to give a shout out in absentia to Congresswoman Bonnie Watson Coleman. We've got Old Bridge Mayor Henry Owen with us. Henry, great to be with you, another terrific leader. Jim Polos, former freeholder, now the Executive Director of the Middlesex County Improvement Authority. I also want to thank CVS for being a partner here to deliver and administer these vaccines, and representing them is their Regional Director, the woman to my right, CVS, from CVS Health, Kat Kingston. Kat, thank you for everything you're doing as well. Elsewhere, by the way, CVS is running point here. Elsewhere in our state where Walgreens is handling the incredible responsibility, I want to thank them as well. So this morning a great example of how the fight against this virus has united both public and private sectors, folks from across the aisle on common ground. What we're witnessing here in New Jersey is happening in dozens of other states across the nation. Long-term care facilities across the entire nation, and certainly here, have been crushed by COVID-19. They have borne an outsized burden of this pandemic. And as I have said many times, and by the way, many times with Judy right by my side, while we know we're not alone given the toll on long-term care residents and staff nationwide, we're not going to just sit back and be part of the pack. We're going to break out, move forward, and provide solutions that can serve as national models. We have implemented, both through direct action and in partnership with our legislative partners, thank you, Sam, and your colleagues, countless short, medium, and long-term solutions to the systemic shortcomings this pandemic has exposed and laid bare. Our goal has consistently been to not just meet the current challenges, but to ensure both high-quality care and the safety of residents and staff going forward. And that is why seeing these vaccines being administered here today is such a tremendous moment. It is a big step toward that goal. So vaccination is not just about ending this pandemic. It's a step toward a stronger and more resilient future. It's a step toward allowing the residents here to once again be able to see and hold their loved ones. And that day will come. But right now our focus remains squarely on the task ahead. The task of vaccinating our most vulnerable residents here and in other long-term care and congregate living facilities. While we undertake this process, it is on all of us to continue doing the basics, the practices that we know are the only ways short of safe and effective vaccines to slow and stop the spread. And you know what they are: social distancing, wearing our masks, washing our hands with soap and water, using common sense. Let there be no doubt, as our vaccine program unfolds and as millions of New Jerseyans become eligible for vaccination, and as they step forward and roll up their sleeves, as the folks here at the Roosevelt Care Center are, we get closer to defeating this virus. Over the past 9 months, our state has paid a tremendous price. We have gone through some dark times together as one New Jersey family, but the light is starting to break on the horizon, and our fight to end this pandemic is just starting to kick into its highest gear yet. 2020 may be remembered by many as a lost year, but let's rally together and make sure 2021 is the year we get New Jersey back and moving it ever forward. So again, I want to thank the terrific team here at Roosevelt Care Center, as well as the team at Complete Care Management, and to the nursing home operators across our state who are on the front lines working with their staffs doing the right things to keep their residents safe. I say thank you. Please help me welcome with that the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichelli.
Thank you, Governor. And to Senator Thompson, it's always a pleasure to have you, who used to be at the Department of Health as an employee, join us. And to the Mayor and the Commissioner. And to Roosevelt Care Center for allowing us to be with you today. Today marks the beginning of the Federal Pharmacy Partnership Program to vaccinate the residents and staff of our 655 long-term care facilities in the state. Almost 300 facilities have already been scheduled through our partnership with CVS. Thank you. This program will hopefully be the most effective step in our initiatives to protect the most vulnerable members of our long-term care communities, the residents, and those who care for them. The staff working in long-term care centers are some of the unsung heroes of this pandemic. Many of them endured the darkest of days during the first surge in April and have continued to care for their residents, our mothers and fathers, our grandparents, and our loved ones every single day. It is fitting that we protect them with this vaccine as well. In New Jersey and across the nation, as the Governor shared, the COVID-19 virus has had a devastating effect on the residents and staff in our facilities. And this virus continues to be unrelenting. The virus continues to enter our facilities with over 400 reporting outbreaks. The issues we faced in long-term care challenged us at the department to examine ways to improve the resiliency of this industry. Last May, we contracted with Manette Health, a nationally recognized team of experts, to conduct a thorough review and make recommendations to stabilize and strengthen the long-term care in our state. To date, 32 of their recommendations have been implemented. The Department of Health has developed a comprehensive testing plan for staff and residents and recently conducted a pilot to study the incidence of asymptomatic spread in our facilities. Approximately 2.7 million tests have been performed in our long-term care facilities in our state. In May, we issued an executive directive requiring all facilities to post their outbreak plans that include infection prevention, cohorting, and isolation practices. The state has provided $78 million to improve the wages of our certified nurse aides. In October, Governor Murphy signed bills requiring staff-to-patient ratios and policies to prevent the social isolation during an outbreak. The Department of Health has established the Office of Long-Term Care Resiliency and set up an emergency operations center. The center will serve as a centralized command and communications center to immediately respond to issues and challenges of the expected second wave. Additionally, the department has mandated that every facility have an infection preventionist on staff and also report staff illnesses and staff quarantine status. The introduction of this vaccine will now supplement our responses to this deadly virus, along with the actions we have taken to protect our most vulnerable New Jerseyans. Overall, in New Jersey, we hope to vaccinate 70% of the eligible adult population in a 6-month period. Yes, that is an aspirational and aggressive but needed goal. In the meantime, we must all remain vigilant. We need to continue wearing a mask, washing our hands frequently, practice social distancing, and if you feel sick, call your provider and get tested. It will take all of us working together to end this pandemic. There is still so much more work to be done until this virus has no place to go. Today, however, is a day of celebration. It's a day when the significant scientific accomplishment of 2 vaccines available in less than a year should be rejoiced, and the start of a new year in our journey of hope against this virus. Thank you.
Judy, thank you for those remarks and for everything you do. Judy and I will be together again at 1 o'clock at the War Memorial in Trenton for an update on COVID more generally. I don't have any data overnight. We had I think as a data matter, Judy, we had a decent weekend. We're a little bit, both of us, questioning, I think, whether or not the holiday may have distorted that, but hospitalizations are hard numbers, and those are down over the past couple of days, so God willing that continues. Again, it takes a village. You can't do this by yourself, no matter how good you may think you are, and in this case, there are a number of partners who helped us to get to today and will be working with us in the months ahead, and one of them, importantly, is CVS Health. So please help me welcome their Regional Director, Kat Kingston. Kat, welcome.
Hello, good morning, everyone. My name is Kat Kingston, and I am one of the Region Directors with CVS Health here in the great state of New Jersey. So thank you, Governor Murphy, thank you, Commissioner, and thank you to the staff and residents here at the Roosevelt Care Center for having us. We really appreciate everything you all are doing on behalf of the people of New Jersey. At CVS Health, our team of healthcare professionals, our pharmacists, nurse practitioners, licensed pharmacy technicians, have had significant experience administering vaccinations, and we're really excited to be a part of the solution here in New Jersey and in states across the country. We know that long-term care facilities have been disproportionately impacted by this pandemic and that they are anxious to be reconnected to their loved ones. And receiving this vaccine today is the first step in that process. Our work here today in New Jersey, administering this vaccine, has been the culmination of months of internal planning and really demonstrates how the private sector can use its expertise to help us solve some of our most critical challenges. We are really grateful for the Herculean efforts of everyone that's been involved, and especially our healthcare professionals that are deployed here today and throughout the country to start to bring some peace of mind to these long-term care facility residents and staff. Vaccinating one of our most vulnerable populations is the latest milestone in our multifaceted pandemic response, which has included testing more than 10 million people for the virus since March. The availability and administration of the COVID-19 vaccines will bring us one step closer to overcoming the most significant health challenge of our entire lifetime. I want to personally thank my entire team that's here today. Most of them are inside getting prepared, but we have a few that are out here, so really thank you guys. And thank you to every single one of our CVS Health colleagues across the country that will be participating in our COVID-19 vaccination efforts. We really appreciate the partnership the state has provided to us. And with that, we're going to get to work, and everybody stay safe and Happy New Year.
Thank you, Kat, and thank you for, I asked where the CVS folks were from, and you guys, using the diplomatic phrase, schlepped from a great distance this morning, so thanks for being here. I mentioned that we don't do what we do without a lot of partners. CVS Health, thank you for that. Our legislative partners on both sides of the aisle have been extraordinarily important, as they always are, but especially the relationship over the past 9 months. And it's my honor to welcome a dear friend representing the 12th District, State Senator Sam Thompson. Sam, come on down.
Thank you, Governor. I will be very brief. This is a very significant step that we're taking in getting the immunization into our long-term care facilities. Thus, that is the most vulnerable population we have in the state. We have seen almost 50% of the fatalities occur in long-term care facilities. In fact, the first outbreak was recognized at a long-term care facility out in Washington State. So it is so vital that we get these people immunized very soon. And I think with the availability of the immunizations now developed on a God, what a record time, the vaccines. We can see the light at the end of the tunnel. It's not going to be tomorrow. It's not going to be the next day, but we can see where it's going to come. I want to thank the governor, the commissioner, and others who have arranged this today and spreading this vaccine throughout the state, and encourage everybody. Get it, let's get it over with, and get on with our lives. Thank you.
Thank you, Sam. Thank you, Sam. And thanks for all your partnership throughout this. Mother Nature is not cooperating here. You could never plan for everything, I guess, right? Sam, thank you for that. All levels of government have played an essential role, and that includes county government. And no county runs better than this one in Middlesex County. Please help me welcome the director of the last time I'm going to say this, Ronnie, of the Freeholder Board of Chosen Freeholders. As of Friday, it is the county commissioners. Please help me welcome a great leader, Ron Rios. Ronnie? Love you, buddy. What's the last name? I'll say Freeholder.
That's it. Good morning and welcome everyone to the greatest county, Middlesex County. Thank you for being here with us today. We're honored to have Governor Murphy, Commissioner Persicelli, and other officials present here today with us for this historic occasion. On behalf of the Board of County Commissioners, Middlesex County Improvement Authority Chairman Jim Nolan, the MCIA Board of Trustees, we are proud to join the state in bringing this all-important, game-changing vaccine to our elderly residents at Roosevelt Care Center and at long-term care centers across the state. This next step in the vaccination process is going to bring much-needed peace of mind to all our communities. This year has been a trying one for all of us. The pandemic has impacted everyone, especially high-risk persons in facilities like this one. Now, as vaccine deployment commences across our county, our state, our nation, there is hope and relief for our community. We are eager and excited to work with the governor and his team to continue the deployment of this vaccine in the coming months. The county is grateful for the continued partnership we have with officials at the local and state level. The collaboration at all levels of government has only strengthened during this time and has been invaluable to our fight against the virus. It is those partnerships that will continue to see us through this time and bring our communities through this pandemic stronger and in good health. I would also like to take a moment to commend our management partner for the Roosevelt Care Centers, Robert Wood Johnson, Barnabas Health. They have been by our side, ensuring we provide best-in-class care for not only the residents of these facilities, but in supporting all our county's residents throughout the COVID-19 pandemic. Again, thank you to Governor Murphy, Commissioner Persicelli for being here today, and all our healthcare workers and staff for your dedication and love caring for our residents. Thank you.
Thank you, Ronnie. Well done, man. Thank you, Ron, and thanks for your partnership throughout this. We'll take a couple of very quick questions if you got them. Otherwise, we'll head to the exits, please. Nice to see you. Yeah, I've answered this about 20 times, but I'll answer it for the last time, perhaps, at this point. We made a decision, led by the Commissioner of the Department of Health, completely endorsed by me, that we were going to reach out to a much broader set of communities in our state, not just the traditional long-term care, as in nursing homes, assisted livings, but to include homes for developmentally disabled and others. So our application is much broader, much bigger than any other American state in terms of the definition. And we took a calculated, I think, wise and proactive risk that by doing so, waiting a few days, we would allow ourselves to be able to get into the CVS Walgreens federal plan, paid for completely by the feds, administered with CVS and Walgreens, completely by the feds, to a much broader set of communities. And that's a decision that we're very comfortable with. Please. So Judy, the CDC guidance is to this is so-called 1A we're in right now, healthcare workers, long-term care, resident and staff. The CDC has recommended that the first groups of that's the 1A group, the first groups of the 1B group would include frontline essential workers, and they have a specific recommendation as to what that group would look like, and seniors 75 years old and up. Judy, you're in the process with your independent board and advisors of taking that CDC recommendation and figuring out what exactly we'll do in New Jersey, as I believe every other American state is doing. Hold tight, and God, listen, we think the general public, every one of us, could have access to this vaccine by April or May. Let's be conservative and say May. So this is a question of between now and then. I'm good. Brian. Please. This is the Board of Trustees? Okay. First I'm hearing of it. It's the first of its kind that I'm hearing, at least. I don't think other organizations have designated their boards as frontline healthcare workers, to the best of my knowledge, so I don't have any more insight on that. Ramping up, I think you're trying to get through the entire 1A population by the end of January, if you can, right? So this is going to ramp up dramatically. Judy mentioned this. Almost just under 300 locations have already signed up. Please, I'll come to you. Hi, Katie. We're on track given the supply that we're getting. So there's a demand-supply imbalance that will exist for some number of weeks, if not a couple of months. But given that reality, we're on track. Please. Hi, Michael. From the bill that this president just signed?
Yeah, is it enough? And also, are there more details on non-hospital healthcare workers?
So is it enough? I would say the bill, first of all, I'm gratified the president signed it. I wish it hadn't taken as long, and there's a lot of dislocation, particularly folks who are unemployed. We'll use every dime that's coming our way, I promise you. But as a general matter, it's not enough. Again, we need it. We'll use it. Not enough. And I believe that also holds true for the support for vaccines. And your second question was healthcare workers who are non-hospital healthcare, Judy? Do you want come on down? Sorry.
Is the question, how are they being vaccinated? We have some details, yes. Rite Aid Pharmacy is opening up this week for all community VNAs, Visiting Nurse Associations, community health. Essex County opened up 4 centers over the weekend. On Saturday, they vaccinated over 600 individuals, all 1A healthcare workers outside of facilities in the community. We expect by the end of January to have over 200 sites for individuals from the community to be vaccinated. And there's 650,000 healthcare workers in New Jersey that fit into the 1A category. So we hope to get as many as possible.
I'd also add Jim Tedesco in Bergen County sent me a note over the weekend. They're open for business at Newbridge. So there's a whole, those mega sites, by the way, as well as the many 100 of other smaller sites, they are all, until further notice, until we plow through the 1A categories, designated for either healthcare workers or long-term care. Anybody else? Yes, ma'am.
Sophie with NJ.com.
Hi, Sophie.
How many people do you expect to get the vaccine? And also, when do you expect there to be a schedule for all the long-term care vaccinations?
Well, a vaccination schedule for long-term care is building. As Judy said, there's almost 300 sites already signed up, and that number will continue to ramp up over the next couple of weeks. So today is the 28th of December. We're hoping by the end of January, early February, to have plowed through the entire 1A community. And sorry, your first question?
How many people do you expect in long-term care?
This week? Do you have an answer, Judy? I don't think I've got an answer off the top of our head, but we can let you know because that's known. Please. How are you? I don't think there is, no. Esther, what was your reaction when you got the vaccine? Come on down. Do you want to? Sorry, whoops. There you go. That's it. That's.
I'm sorry, what was the question?
What was your reaction when you got the vaccine?
I felt normal. I was excited to receive it. I was nervous, but it was beautiful. And I'm glad I got it. I'm glad I'm the first one to get it too.
Amen. Do you know Mildred?
Mildred, not personally. She's on a different unit.
Thank you.
Yes.
One more. Sorry, one more, please. Thank you. Too early to tell. The question is, are we, when we look at the next sort of 5-6 months, how does that impact reopening of the state and what we're thinking? We are where we are right now. We have to make a decision, which will need to be very soon. I'm sorry? I say it's too early to tell, but we're staying where we are right now. We have to make a decision on indoor sports. That temporary ban expires on Saturday, so that's something that's before us in a matter of days. Beyond that, we're going to stay where we are. My guess is that we probably do what we did, which is when we begin to reopen, we do it very gradually. I don't think there's going to be one day to the next that all of a sudden we're full open. I want to thank Esther again for your great words and your leadership. Judy, as always. Kat, thank you to you and your CVS colleagues. Senator Sam Thompson, I think, had to duck out. Director Ronnie Rios, bless you. Mayor Henry Owens, thank you so much. Jim Polos, as always. To the Roosevelt Care team, to the entirety of the group here today, we can't thank you enough. Blessings, and we don't see you beforehand. Happy New Year. Judy and I will be on at 1 o'clock today. Thank you.